en inglés. Welcome back to this series of webinars from the Research Institute for Equitable Development, Equide by its acronym in Spanish, of the Iberoamericana University. I'm Dr. Mauricio Hernandez, Associate Professor at Equide. I have the privilege of moderating the webinar corresponding to the project BBF. Briefly, Becoming Breastfeeding Friendly Initiative provides countries with a multi-sectoral self-assessment tool and indicates steps to take to improve their efforts to promote, protect, and support breastfeeding. The Mexico's 2020 process was the first in the world to be implemented 100% virtually, reducing operating costs and adapting to healthy distance measures by COVID-19. Today, we have the privilege of having Dr. Mireya Vilar as a speaker. She is an associate professor in the Department of Public Health at Montclair State University, USA. She holds a PhD in healthy policy from New York University. Her lines of research focus on areas such as food insecurity, breastfeeding, and early child nutrition. Her research has been funded by international agencies, and she has worked in coordination with multilateral organizations at researchers at universities from different regions around the world. Her research has led to the identification of feasible, evidence-based interventions. She has more than 50 research articles published in leading international scientific journals. Later, I will introduce our outstanding commentators, Dr. Rafael Perez Camilla and Sonia Hernandez Cordero. Welcome back, Dr. Mireya Vilar. Please go ahead with your presentation.
Thank you so much, Mauricio, and it's a pleasure to be back at Equide and Universidad Iberoamericana, where I actually started this research in collaboration both with Sonia and Rafael. And today I want to focus on actually presenting the outcomes of the Becoming Breastfeeding Friendly Index in Mexico that was conducted measuring the 2020, although it took more than 1 year to actually be performed as we had the COVID-19 pandemic striking that led us to do very important adaptations. So before getting started with the BBF, I just want to remind that the World Health Organization establishes that optimal breastfeeding needs to have 3 characteristics. The first one is that it needs to start early, when early initiation implies that breastfeeding should start within the first hour after birth. The second characteristic is that it should be exclusive, and exclusive breastfeeding implies that there is nothing rather than breast milk being introduced to the baby, and exclusive breastfeeding should be held for at least 6 months for the first 6 months of life. And then duration, the introduction of complementary nutritious foods should start around 6 months. And once this has started, breastfeeding should continue for up to 2 years of age or beyond as mom and the diet mom and baby decide. So it is very important to keep in mind that this is optimal breastfeeding, because actually optimal breastfeeding has benefits for the baby, the mom's family, society, and the planet. I will present some of the benefits to the children now. And in the short term, one of the main benefits is that actually it reduces infant mortality. It is known that suboptimal breastfeeding actually contributes to around 12% of mortality for kids under 5 years of age. Equally, some of the short-term benefits for the babies, they are around the fact that it reduces infant morbidity of conditions such as diarrhea and respiratory infections, and some other conditions such as otitis, malocclusion, and asthma. Importantly, breastfeeding also has long-term effects for the children. For example, it's been associated with a reduction in 26% in the odds of overweight and obesity later in life. It's also associated with a 19% reduction in the incidence of childhood leukemia, as well as a reduction associated in type 1 diabetes. And then there is another family of long-term indicators that have to do with the intelligence quotient, or IQ, and it has been associated with an increase of 2.6 increases at 6 years of age. And there are two things that I want to highlight. While 2.6 points at the individual level might look something tiny, when we aggregate this as a society or as a country, it doesn't become that small. And more importantly, it's like some of these long-term cognitive benefits have been associated with increased performance 30 years later. So the long-term benefits of breastfeeding are substantial. And also breastfeeding has important benefits for the mothers. During lactation, breastfeeding is associated with a decreased risk of postpartum blood loss, and also lactation amenorrhea, which implies that there is a delay in resumption of ovulation, which is important from a reproductive or pregnancy planning perspective. And it's like some studies have been associated, the breastfeeding has been associated to postpartum depression and reduction in weight change, although the evidence is insufficient to hold this as a benefit, such as the ones that I presented before. In the long term, there are also very important benefits to the mothers. In some of the more relevant ones, a reduction in the risk of breast, ovarian, and endometrial cancer, as well as a reduction in cardiovascular disease and in type 2 diabetes. So it is really important to highlight that as a society, the world loses about $1 billion per day. And I repeat the amount, it's $1 billion per day, as a result of not investing in breastfeeding and having moms to breastfeed suboptimally. We know that from this $1 billion, about it's like the largest part comes from a decrease in cognitive development. It's like that it's associated with those long-term benefits that I highlighted before. So based on these findings from prior literature, we know that it's very important to invest in protecting, promoting, and supporting breastfeeding. So how is Mexico doing in terms of breastfeeding? Currently, given the outcomes from the latest Nutrition and Health Survey from 2019, only 1 in 3 babies actually receives breast milk as an exclusive food up to 6 months of life. So, it's like there is a lot that needs to be improved. And we know also that Mexico has one of the lowest rates of breastfeeding in the Latin American region. And, it's like these suboptimal rates of breastfeeding have actually been associated with direct and indirect costs that have to do, for example, with, it's like cost linked to medical conditions, loss in productivity. And, these range from a substantial amount of money that I'm just presenting in the slide right here. So it has economic costs that we should take into account. So, it's like considering all these benefits, there is something that it's the Becoming Breastfeeding Friendly initiative. This initiative is evidence-informed, and it seeks to inform globally. And what this initiative actually does, it helps countries identify the strength of their breastfeeding-friendly environments, but it also helps countries develop recommendations and plans for scaling up breastfeeding policies and programs to improve how breastfeeding friendly they are. In the long term, the objective of the BBF, or Becoming Breastfeeding Friendly, is to identify concrete measures at the country level that can actually increase its breastfeeding rates. If you ever want to know more about the BBF initiative, actually, you can consult this link that I'm showing here that will lead you to the webpage that has all this information. So the Becoming Breastfeeding Friendly, it's actually based on the breastfeeding year model, which I'm portraying on the right. And this breastfeeding model, actually, what it implies, it's like, it's like for a country to have a friendly index, a friendly environment for breastfeeding, it needs to have several parts working in harmony to promote it. For example, we need advocacy, we need political will, legislation, funding, training, promotion, and research, but at the center, we need to have coordination and monitoring at the country level. So, it's like if we are really strong in some of these, but very weak in others, the machinery to have a breastfeeding friendly country, it's not going to work properly because this works in harmony. So we need to be pretty strong in each of these gears. So the Becoming Breastfeeding Gear model actually led to the BBF index that was developed by the Yale School of Public Health to guide countries in assessing the readiness to scale up breastfeeding policies to protect, promote, and support interventions towards breastfeeding at the national level. The BBF index actually was based on evidence-based, and it was developed by a technical advisory group that had people from different sectors in different countries, all of them global breastfeeding experts. So this index actually says the 8 years that I presented before from the breastfeeding year model. And it assesses these years through 58 benchmarks. These benchmarks lead to scores. And then what we can have is scores for each of the years, but we can also produce one total score for the country that it's going to tell us how weak or strong it's the environment towards breastfeeding. The goal, again, is remember to allow countries to identify the gaps within each of these gears. It's like which are the stronger ones, which are the weaker ones, and then it's like propose some interventions to fill up these gaps through recommendations to stakeholders and policymakers. So to actually the toolbox of the BBF index, it's placed together so that it can be performed through a multi-sectorial and very participatory approach throughout 5 meetings. So Mexico and Ghana were actually pilot countries, and they led to doing this index twice, one in 2016 and 2018. So in Mexico, we decided we wanted to do it again in 2020. And one of the reasons why we decided to do so, it's because we had a change in administration that we saw that it could be a challenge for breastfeeding policies. So we went ahead and decided to do with own financing, because the prior BBF editions had been externally financed, and the BBF 2020 was financed by Equide, which is a Mexican institution. So when we were just starting to plan for the BBF 2020 COVID stroke, and the pandemic actually led to a great adaptation of the toolbox of the BBF and led to a virtual modality. So this virtual modality, what it implies is that these 5 traditional meeting process that I had shown before needed to be held using diverse digital platforms, Zoom, WhatsApp, Padlet, YouTube, leading to the adaptation of the BBF toolbox. So what I really want to do today is actually guide you to how we did that, it's like the virtual adaptation, as well as to show you how is the index in 2020 compared to prior years, and what are the implications of this index for the breastfeeding in Mexico. So one of the first things that you need to do for the BBF index is put together a committee that, it's the one that it's going to go through all these meetings together. And to score each of the benchmarks and the years and the country as a whole. So in prior years, we had people from academia, from civil society and NGOs, international organizations, and government. In 2020, we actually hold a larger committee. Instead of being 13, 11, we actually increased it to 14. And we had representation from all these different organisms. So what I want to highlight is that even that we went virtual, the BBF Committee 2020 was equally multidisciplinary and multisectoral than in prior years, but it was fully virtual. Here are all the great people that helped participated in the committee and all the organizations that these people are affiliated to. And I want to publicly thank them for all their work and dedication. So, it's like our first challenge, how we convert this into a virtual meeting, because, for example, these meetings would take a full day. So, I cannot have people for a full day in Zoom. That would be horrible and inefficient. So we needed to innovate and drive a different process. And, I just want to highlight here some of the things that have stars and are in circles. So one of the first things is that we decided to do a steering committee, that it was precisely Dr. Perez, Camilla, Dr. Hernandez, and myself that put together this steering committee to actually try to help everyone navigate this process. So this is something different from prior BBFs. And all the meetings were held virtually using mostly the Zoom platform. And the other thing is, like before, it's like in the working meetings, we would divide to score different years. But here we actually needed to do formal sub-working groups. And these sub-working groups were formed during the first meeting. And each of these subgroups worked a lot in between meetings because, it's like that session that was 8 hours long, like a full day, it took 2 hours. So, it's like a lot of the work was held by the working groups in between the big sessions. And the subgrouping works actually use Padlet, WhatsApp, and Zoom to actually connect between each other. So, for example, for scoring the benchmarks, it's like in the traditional BBF method, we will actually vote, raising our hands. In here, we actually needed to do it through Zoom polls, and reaching consensus was aided a lot by a very structured use of the chat. And, it's like other things that, were very different as well. It's like before we were prioritize the recommendations that were emerging from the BBF, while we were there together, we would assess that. And here, actually, we would use tools such as RedCap to prioritize this process through a toolbox that the BBF already had. Finally, it's like some of the latter, adaptations, it's like before we would held a very robust in-person meeting with stakeholders, many of them government stakeholders and decision makers. And, it's like this was impossible given COVID. So we actually launched a virtual event. But, it's like part of preparing this event was putting together a Twitter social media campaign. And we actually opened a BBF Twitter account that is still active today. And this actually led to a YouTube streaming of an event that was 2 hours long. And we actually did what it was supposed to do, that it was give these recommendations to stakeholders. So, it's like going back to the traditional BBF index. Remember that we need to score 8 gears and 58 benchmarks. And in doing so, it's like you have some scores in the interpretation of the scores. What I want to say is that we were able to collect all the information digitally or through remote tools during COVID, and all the gears and benchmarks were actually assessed. So I think that this by itself, it's a really good achievement. And, it's like we were also able to provide these recommendations that were prioritized using digital tools and were actually given to policymakers through electronic policy briefs and through actually having a very active presence in the social media and through the event that we launched online. So let me share some of the results. So in the advocacy gear that measures the presence and degree of advocacy to protect, promote, and support breastfeeding, it's like in things such as public attention, individual champions, and, it's like the mobilization of social cohesion around breastfeeding. It's like compared to 2018, we actually decreased. So, it's like we passed from being strong to being moderate in strength, to how friendly we are. So this actually is a gear that decreased. In terms of political will, this gear actually measures express commitment by government to protect, promote, and support breastfeeding. And we actually found that, there are government officials or, it's like government related figures that are protecting, promoting, and supporting breastfeeding, even if it's not through the most coordinated way. But this is something that we actually arrived to the same score that we had it's like in 2018, and it's actually stronger than in 2016. So in terms of legislations and policies, this gear actually assesses the adoption, coverage, and quality of key breastfeeding policies and legislation, among them the National Breastfeeding Policy. So in this case was, for example, the strategia, the strategy linked to the National Strategy for Breastfeeding, the Baby Friendly Hospital Initiative, the International Code of Marketing of Breast Milk Substitutes, and the National Maternity Protection Legislation, so the maternity leave. And what we've actually been seeing is an erosion and deterioration throughout the years. So this is something that it's causing a lot of distress among the people who form part of the committee. We are seeing that this is something that it's becoming weaker. And still, we still got into moderate strength, but, it's like it dropped by 0.4 compared to 2018. So this is one of the most worrying gears, that it's the gear linked to funding and resources. and assesses the availability and adequacy at the country level of funding and other resources that are necessary to scale up and maintain breastfeeding programs and initiatives. This has been a super weak year ever since we started measuring the BBF index. And, truly, it's something that we've actually been trying to address with policymakers, and no change has been made. And this is an urgent call for policymakers and legislators. The fifth gear that has to do with training and program delivery actually looks at things such as improving workforce capacity through training and the level of coverage and quality of breastfeeding program delivery. And this is something that you can see throughout the years how much it's been eroded. And one of the things that actually led to this erosion, it's that in 2016, we had programs such as the Sesión, which was a national strategy for nutrition in the early life period, it's like from pregnancy to 5 years of age. And this was actually removed out of the agenda by the new government. So there is nothing really substituting this at this point when we measure this. So this is an urgent area of attention that needs to go here. Then the promotion gear has to do whether we have a national breastfeeding promotion strategy and whether the government and NGOs are actually, it's like promoting breastfeeding. Again, it's like we see that this is something that got worse. And part of this worsening also has to do with the fact that with the new administration, the National Breastfeeding Promotion Strategy was not, renewed. So now we are seeing some efforts to put something together in the governmental plans, but it is not as robust as it was before. And even before was not perfect. It was moderate in strength. So this is another area of worrisome. Then research and evaluation, it's another of these gears that we've seen that it's weak throughout the process. Despite the fact that Mexico has relevant surveys such as the National Nutrition and Health Survey in Salud collecting data, some of the things that we've seen is that there are no monitoring systems within the health systems to actually have process indicators and breastfeeding outcomes within the health systems, which has led to actually have this overall weakness in the index. Then, before, in terms of the coordination, we had the national strategy that helped coordinating lots of the efforts. However, as this strategy eroded with the new administration that came into office between 2018 and 2020, what we are seeing is that we don't have a coordination set of rules and bodies for breastfeeding in place. So this is really worrisome because it's part of the machine, it's like it's in the center of the gear model and it helps, it's like move the rest of them. So this to us, it's a big erosion and it is something that it's causing potentially a lot of problems in the future. So overall, how did we do? So Mexico actually had a moderate scaling up environment, which has been constant throughout the years in which we've been measuring. But what I want to bring to your attention is that actually the indicators have decreased and we are really close to actually moving into a weak scaling up environment for breastfeeding. So, this should be a call to action to different stakeholders and decision makers, because otherwise what we're going to see is that outcomes in breastfeeding might actually be worsening in the next years. So we were able to do 5, we had lots of recommendations to stakeholders, but we were able through the prioritization tool to get it to 5 recommendations. This was the financing, data collection, and timely release of breastfeeding information, that it was one of these really weak gears. The creation of a permanent and multi-sectoral breastfeeding coordination group to put this piece in the center, that would aid us work throughout the gear model, to intensify advocacy and develop lobbying promotion breastfeeding strategies with key stakeholders, especially as we've seen that, not necessarily this government has paid a lot of attention to breastfeeding. So then we really need to advocate at other levels of government, such as the legislative power. Improve the duration and enforcement of maternity leave schemes. And this is something that we've been working since 2016. And I will address this in a second, but you know, it's something in which we feel there's momentum and we need to improve this, and strengthen breastfeeding training pre and in service. So for each of these recommendations, we actually have an online or electronic policy brief that has been distributed to different stakeholders to push them to recognize these strategies. So in conclusion, you know, it's like some of our key findings, it's that we see a worrisome erosion of several of the indicators. Mexico between 2012 and 2019, so you know, it's like some improvement in breastfeeding rates, very important improvement. But what we see, it's like if this environment keeps, you know, worsening in the near years, you know, it's like we will see again a decrease in breastfeeding rates. So although the total score has been kept in the moderate scaling of environment, it's really nearing weak environment. So we really need to have a call for action. And because otherwise this will actually lead to, you know, to having a non-adequate environment for the protection, promotion, and support for breastfeeding, which will have long and short-term effects. Some of the lessons that we've learned. So, you know, like some positive actions. For example, I was mentioning around maternity leave that we've been working throughout 2016. So we actually costed how much it would cost to, how much it would be to expand 1 week of maternity leave. And, you know, it's like using these numbers in 2018, actually, there was a bill that proposed to increase the number of maternity leave weeks in the country. You know, it's like, and unfortunately with COVID, it was stopped in the lower chamber, and now it's trying to be reactivated. Some other positive actions, it's like all this interaction that the BBF committee has had, and all the actions that I have actually, you know, it's like been promoted through all these policy briefs. I think they have helped international organizations and civil society increase actions, research, and visibility of breastfeeding around areas such as the code, breastfeeding marketing, and breastfeeding at the workplace. And for example, breastfeeding at the workplace, we've actually done a lot of work with UNICEF. Some that require urgent action have to do with budget, as I referred before, baby-friendly hospital initiative, as well as, you know, it's like, while we've been working for maternity leave in the formal sector, we need to work for women employed in the informal sector, and the coordination, it's urgent. Lastly, you know, it's like, I just want to highlight that the virtual adaptation was feasible. You know, it's like, it was really feasible. Nevertheless, it must be considered that this is something that perhaps was feasible because it was the third time that Mexico was performing the BBF. The COVID was an important stressor for the whole process because, you know, it's like availability of information was limited because the public health sector had other priorities. And the same goes to the fact that we actually were collecting this during COVID and during, you know, this weird transition of an administration that has changed many, many things. So in the future, you know, countries may opt to have a virtual or a hybrid BBF method. And, you know, it's like, I think this will call to actually expand the BBF tool to have these 3 different modalities: in-person, completely virtual, or hybrid. And countries may opt to actually go for one way or the other. So I will stop here. I thank you. And, you know, it's like, I publicly want to acknowledge all the support that we've been getting from the Yale School of Public Health, as well as all the institutions that are highlighted here. And I think that BBF actually has made really strong links in Mexico and relationships of all these groups that are here to really be a group that it's promoting, supporting, and protecting breastfeeding in a constant manner. Thank you so much.
Thank you, Dr. Mireya Vilar for the presentation. Our first commentator is Dr. Rafael Perez Camilla. He is Professor of Public Health, Director of the Office of Public Health Practice, and Director of the Global Health Concentration at the Yale School of Public Health. His Global Public Health Nutrition and Food Security Research Program has contributed to improvements in breastfeeding and other maternal, infant, and young child nutrition outcomes, iron deficiency, anemia among infant, household food security, and early child development. He has published over 280 research articles, books, monographs, and numerous journal supplements, book chapters, and technical reports. He is a member of the U.S. National Academy of Medicine. Please, Dr. Perez Camilla.
Thank you very much, Mauricio. So first of all, I would like to express my deep thanks and admiration to the Mexico's BBF committee. We know how difficult the past 2.5 years have been for Mexico and the rest of the world. But this is a prime example of what we like to say in English: when there is a will, there is a way. And this committee was intersectoral, with representation for multiple entities from government. It included a civil society representation, as Mireya has mentioned, as well as the academic sector and representatives from international organizations. As a result of this third very successful application of the BBF process in Mexico, the world now has at its disposal a 100% virtual methodology on how to run this process with excellence. We are now moving into the global phase for BBF, where we are transitioning all the know-how from Yale University and partners into regional hubs that will be located in different parts of the world, so that the countries that are selected within each region will be responsible for actually being the ones building capacity among their neighboring countries. At the end of the day, BBF is a powerful policy toolbox that can definitely help the countries work better together, bring better coordination, better national strategies, and for reasonable and feasible policy recommendations to be made. But it is just one tool that generates numbers. At the end of the day, it is also very important to integrate the BBF tool as part of the suite of other tools that should be part of a global toolbox to, for example, bring the translation of the policy recommendations into actual behavior change practices with regards to infant feeding decisions that end up happening as a result of very complex interpersonal interactions at the family, community, and society at large level. I'm mentioning this because this is just the beginning of a long road for Mexico, as well as many other countries in the world, to actually scale up and maintain much more effective breastfeeding protection, promotion, and support programs. And we would be very naive to think that just because there is political will in one administration, that will continue into the next administration. We know that that's not the way political systems and modern economic systems operate. So we really hope that we learn much better how to address the structural determinants of breastfeeding, how we learn much more within a framework of complex adaptive systems upon which a BBF is built, how to identify the very negative feedback loops that are coming from very powerful sectors such as the infant formula industry that spends billions of dollars every year all over the world to undermine the work that committees like BBF and countries like Mexico are trying to do. We need to learn how to organize ourselves in a much better way as civil society organizations. We need to learn how to coordinate much better our actions and activities from the national to the municipal level. But at the end of the day, the Mexican government has to own it. It is on the Mexican government shoulders the responsibility to take advantage of the enormous work that this committee, as well as other groups in Mexico that are fighting very hard for the cause of breastfeeding, maternal, infant, and young child health, to actually put into practice the knowledge gathered from this incredible effort. And at the end of the day, I think this is going to require having much more improved management information systems, monitoring and evaluation systems, so that decision makers can be held accountable. This is especially the case with breastfeeding, where we know, as Mireya mentioned, that countries are losing hundreds and hundreds and hundreds of millions of dollars every year in national productivity as a result of not investing in it. And it is inexcusable, because this is one of the few areas in maternal child public health nutrition where we actually have plenty of interventions across the different layers of the social ecological model that work, and that we have very strong empirical evidence showing that when governments scale them up and invest in them, they are actually highly sustainable. And governments can see results, for example, in improved exclusive breastfeeding rates in a very short period of time. So there are no ifs, there are no buts. I really hope that the Mexican government takes these recommendations as seriously as they should be if they truly care about the future of Mexico and the well-being of its infants, young children, their mothers, and their families. So thank you so very much for the opportunity to respond to this incredibly important presentation. Thank you, Mauricio.
Thank you, Dr. Rafael Perez Camilla. I remind attendees to ask their questions to our guest. Our second commentator is Dr. Sonia Hernandez Cordero. She holds a PhD in International Nutrition from Cornell University. She is Associate Professor at the Equide. Her research focuses on generating evidence that translates into public health, food and nutrition policies to promote maternal and child nutrition, with special emphasis on breastfeeding. She has collaborated with Mexican and international interdisciplinary teams using evidence-based approaches. In addition, she has collaborated in the design and evaluation of evidence-based strategies to prevent obesity following a life course approach. Please, Dr. Hernandez Cordero.
Thank you, Mauricio, for the introduction. Thank you, Mireya, for your presentation, and thank you, Rafael, for your thoughts. Mireya, I think, again, thank you for the very excellent presentation, which provide us with very valuable information, and I will mention them one by one. The first one, I think it's very important to know and understand the BBF initiative, all the process that is behind, and all the insights that you can get from this, applying this toolbox. And I think this becomes very relevant because it doesn't just provide this evidence-based recommendation, but involves a country committee of breastfeeding experts across, as you mentioned on your presentation, across government, academia, international organizations, and civil society. And I think this committee engages during the entire process, since the beginning until the end. So I think this is very useful because it creates a group of experts that are working in a coordinated manner, and then later on they can keep working and doing advocacy and promoting all these important topics and all the important recommendations that the BBF provides, all the BBF process provides. So I think that is very, very useful. And second one, it's important to learn about the results of the 3 BBF wages that we have had in Mexico. It is important to know how the global score has changed, as well as on each of the years. So we are not just looking at one cross-sectional evaluation or just one photograph, but we are seeing how they have been changing across time. So this allow us to point out, identify those years that we have to pay more attention, not just because how they are right now, but how they have been changing across time. So I think that is very valuable as well. And finally, I think this BBF virtual adaptation, it's providing something that is very innovative, as Rafael mentioned before. And I think this kind of adaptations or modality in research, or particularly in BBF, it's very pertinent now in context as the pandemic. And I'm sure that unfortunately, we will have more of these events in the future. So I think it is very, very useful to have these kind of tools and to see how this adaptation work, and that this adaptation were possible without affecting the methodological quality of the research. So I think that is very valuable as well. So I will stop that with my comments for now. So I really appreciate your presentation, Mireya, and I will want to thank you for that. Thanks.
Thank you, Dr. Hernandez Cordero. Please, attendees can make the questions in the Q&A button. I would like to ask a question to Dr. Rafael Perez Camilla. He mentioned the complex adaptive system where breastfeeding promoters works. How could the BBF be framed in a context of food systems? Does it tie in with the year model?
Yes. So first of all, it is a very important question, because breastfeeding is where healthy, nutritious, and sustainable food systems should start. It is just an incredibly important piece of what we now refer to as the first food system. We know that it's not only an incredible source of nutrition for infants, we also know how important it is to help children to self-regulate their food intake. We now know how incredibly important it is for children to learn to develop healthier food preferences by actually tasting a very large diversity of flavors that get passed from the mother's diet into the human milk. And if we take it all the way to the health of the planet, we know how green it is breastfeeding when it comes to environmental sustainability. We know, for example, how we need 4,000 liters of water to produce 1 kilogram of infant formula powder. We know the incredible level of greenhouse emissions that are associated with the cows, the dairy behind the prime material for the vast majority of infant formulas in the world. We also know the amount of fossil fuel that needs to get used not only to produce, but to transport and to store infant formula. And we also know the enormous amount of waste that gets left behind in Mother Nature as a result, and non-biodegradable waste, by the way, as a result of the plastic from infant feeding bottles, as a result of the metal and paper that is contained in formula cans and so on. So we do know that food systems are need to be understood under the lens of complex adaptive systems frameworks. They also have many moving parts. They have many sectors involved. They have many interest groups involved. And at the end of the day, we live in a world where less and less and wealthier and more powerful companies are controlling the food that is made available to us. So there is no doubt in my mind that, for example, in the last United Nations Food Summit, they almost completely left out breastfeeding. In fact, they almost completely left out the first 1,000 days of life. The food system surrounding women during pregnancy, as well as those surrounding infants, that are supposed to start getting solid food starting at 6 months, as well as the situation with children under 5. This is very serious. This is very serious, not thinking of breastfeeding as part of the food system and as the central part in many ways of the first food system. Because by doing that, we are essentially given a blank check to food companies to continue producing, to continue marketing, and to continue pushing the very high consumption of ultra-processed foods and sugar-sweetened beverages since infancy. That is the period that is the most important for shaping food preferences, dietary habits, and the metabolic pathways that human beings are going to follow for the rest of their lives, with regards to whether they're going to be developing obesity or not, whether they are going to be developing non-communicable diseases, such as type 2 diabetes and heart disease later on in life. So just to finalize my answer, Mauricio, as you know, many people just think of the health sector when it comes to breastfeeding, and the health sector should be responsible, and the health sector is where all of this is happening. Well, I would argue that the time for breastfeeding to actually become a very central part of the global call to reform food systems should be also a very central part of those forums and of those sectors that are trying to influence the reform of the food systems so that they can become much more healthier and much less harmful to the health of our planet at the end of the day.
Thank you, Dr. Perez Camilla. We have some minutes. Again, I remind attendees to ask our speaker and guest their questions. Meantime, I have another question. I'm sorry. What happens after the BBF committee communicates the recommendation? What has been learned over the years of applying the BBF in tertiary care, maybe in Mexico or in other countries? I don't know. And maybe Dr. Vilar Comte, if you can answer.
Sure, thank you. So I think that that's a very relevant question, and I will actually address it from the perspective of the Mexican BBF committee. So actually, once the recommendations are put together in this public event that this time was virtual, we actually try to have policymakers compromising, it's like and actually actively saying, I embrace these recommendations and I will move them forward. What we've learned, it's like this embracing has been partial. It's like we do remember that in 2018, it was Dr. Hugo Lopez-Gatell who sat on the table and said, I take these recommendations and I will take actions towards them. Whether it's been COVID or it's been the health reform, I don't know, but it's like I don't think that much has been done of what we actually put there in action. So I mean, there are two pieces that I would add to this. One, it's like in Mexico, the BBF committee, the leading part of the BBF has been academia. And we as academia, I mean, we do have the responsibility of putting knowledge and evidence knowledge there in partnering with other organizations, but I don't think it's our task to actually do the advocacy because we are not advocates, we're researchers. Although, it's like we can partner with so many other institutions and do advocacy from our research perspective. But what it's been clear is that we can partner with organizations such as UNICEF, such as Save the Children, such as el Pacto por la Primera Infancia, el Poder del Consumidor. And they have helped us do a lot of advocacy. And they have actually, for example, Sonia and myself worked really successfully in pushing forward one of the actions that was recommended since the early BBF, that it was breastfeeding at the workplace. So, it's like we actually work with the Ministry of Labor, not through the most efficacious and free conflict of interest, it's like a way, but, it's like it's the way it is. But we put together a communication strategy. We put together different, it's like a training for firms and so on, and a lot of research also to actually push forward this. So this is one small example of what can be done. This BBF, actually, it was CIPINA that said, like, we want to invite you to actually come and sit with us and present the recommendations so we can take some, it's like embracing of this. Whether this is going to be happening, it's still, we're still waiting for the invitation. We also know that CIPINA is going through enough changes right now. And we would like to ask, it's like advocacy organizations to actually push forward some of these recommendations. But I don't know, Sonia or Rafael, if you would like to add something.
Sonia?
Yes, thank you. Thank you. Yes, I think another important thing, and I think we apply it on this last wave of BBF, is that this strategy to disseminate the recommendation in different timing, one before the event for the presentation, then during the presentation, then they were sending tweets about the recommendation, and then until now, we are sending these messages with the recommendations. So these are kept on the agenda and on the attention of the civil society, that as well, they should be very involved, pushing up for the policies to be generated and to be implemented as well.
Thank you, Dr. Hernandez Cordero. Ariana Cajero asks the following: what actions are being carried out in rural communities for the promotion of breastfeeding in Mexico? Someone knows?
I can take that on. So first of all, it's an incredibly important question because there is still the perception that women in rural areas will breastfeed no matter what, and that it is true that in absolute percentages, their breastfeeding rates are still higher than for women in urban areas. But when you look at time trends, when you look at the groups where breastfeeding is going down the fastest, it is precisely in rural communities, including indigenous rural communities. And I recently had the privilege of collaborating with Un Kilo de Ayuda and Professor Diana Bueno from the University of Baja California. And we worked in communities in the state of Mexico with a fair amount of indigenous families living in them. And I can tell you that the whole issue of marketing of infant formulas is as strong in the rural areas as it is in urban areas. The ways that it is done is a lot through the healthcare providers. And it is now becoming really a generational issue where, you know, it is more and more acceptable, and it is becoming a culture of what we call las dos cosas. Now, so there's still breastfeeding, but there is more and more mixed feeding. There is more and more infant formula being offered. And at the same time, in these communities, there was almost no activities related to breastfeeding promotion and support. So I would say that that is a type of question that committees like BBF should take on forward, moving forward, because it is key to really protect as much as possible against the deterioration that is happening in rural areas in Mexico and almost all Latin American countries in breastfeeding outcomes.
Thank you, Dr. Perez Camilla. There is no more questions in YouTube. Someone knows?
No, ninguna, doctor, por el momento.
Okay, thank you. Let me ask the following. How the BBF can illuminate other projects in health and nutrition? What methodological lessons can we take with those? Maybe, I don't know, maybe Dr. Sonia Hernandez, I don't know.
Yes, thank you, Mauricio. That's a very good question as well. I think one of the main lesson from this, the BBF, and how can this helps to approach other nutrition problems, I think it's, as all we know, all health and nutrition problems are very complex, as their determinants are many and there are in different levels. So I think, or I believe, that the approaches to tackle down or to approach to tackle nutrition problems requires evidence-based system based on frameworks, very strong frameworks that consider all these many determinants and all the levels and all the interaction between all the actions. So that will allow to identify like good strategies. That is something that BBF does, and as well to prioritize all the action and strategies to tackle down the nutritional problems.
Okay, Dr. Sonia Hernandez, thanks. And thanks the audience for the questions. We are under time. To conclude, I want to thank our speaker, Dr. Mireya Vilar, and commentators, Dr. Rafael Perez Camilla and Dr. Sonia Hernandez Cordero. Thanks to you, our audience has learned about the potential of the Becoming Breastfeeding Friendly initiative as a tool to improve the efforts of countries to promote, protect, and support breastfeeding, essential to advance in several of the Sustainable Development Goals. On behalf of Dr. Graciela Teruel, Director of Equide, I thank you for your presence. Please keep enjoying this day.
Thank you so much, Mauricio. And I would just like to add that this research was financed by the Research Center for Equitable Development at Universidad Iberoamericana. So that's, shows it's like the commitment they have towards this issue. Thank you so much.
Okay, see you.
Thank you. Thanks you.